Okay, everybody, welcome to our annual interview prep tutorial that the Medina Clinic puts on. And so my name is Dr. Murad. I'm the medical director for the Medina Clinic, and we have with us all our assistant physicians, if not additional folks here joining us today. So, you know, when talking talking about interviews, I just want to share a story. So, when I applied for residency, I can tell you that on paper I was nothing special. Nothing special, very average in a lot of ways. In fact, I can tell you my scores were not outstanding. When I was in medical school, I had a death in the family. My sister passed away when I was in medical school. And I can tell you that this was a very, very difficult time. I couldn't study very well. Actually, I remember my dad asking me, he's like, "Did you study?" And I was like, "Oh yeah, I studied. I studied." And really, I didn't study. So I can say that now because I barely passed, but it was not a great score. Nothing special, but the interview really made a huge difference. Okay, the interview made the difference between, it was night and day as far as prospects for matching. All right. So there is no question that the interview was like everything. Aside from just getting through scores, grades, and all those things, the interview is what helped me get into residency. There's no question. On the flip side, there are times where I've interviewed for something, okay, maybe some position or something, and I interviewed for it. And on paper, no doubt, I was the most qualified person. No doubt. Like on paper, I should definitely get whatever it is that I was applying for. But my interview did not go well. I made mistakes. Okay. So I didn't maybe prepare as well as I should have. I wasn't as well rested as I should have been. These precautions or this prep, I did not do like I maybe normally would. And even though on paper, definitely I should get whatever it is I was applying for, I didn't get it. Okay. So you can see how the interview makes a huge difference. It could take someone who with an average profile and make them a star. It could take someone who's a superstar on paper and make them fail. Okay. So you can see how important the interview is. All right. There are some APs that have gotten one interview, and they matched. Not many, mind you, not very many, but that has happened. Okay, because the interview went well. All right. So that's how important the interview is. Do not underestimate it. The other thing is that, like a lot of us, may have roots in other countries. Like I'm originally Egyptian. Of course, I grew up in the United States, but I can tell you in Egypt, there's no such thing as an interview for med school. Okay. It's whatever your score is. So the United States is not like that. Okay, you need to be able to be personable. You need to be able to connect with people, and rightfully so. And that's a drawback maybe in other places. But you need to be able to be affable. You need to be able to work in a team. Okay. You need to be approachable. Okay. You need to be able to communicate. These are things that are vitally important. So that's why an interview is so important, because it's your one shot besides the application to show people that yes, they should take you. All right. So do not underestimate the importance of prepping and getting ready for an interview. It literally can be life-changing. Now there's some caveats to the approach that I would like to share today, and hopefully to have a robust discussion about. you know, some people are very magnetic, okay? Like anybody will like them, okay? Some people are just natural communicators. Some people are extroverted and they connect with people very easily and very naturally. I can tell you, I am not that person. Okay, I will tell you right now that is not me. Okay, so you know, I am introverted. I do not connect that easily, and you know, of course, you grow up and you mature and you get better. So you know, there's that. But naturally, that is not me. So the caveat I would share with this method is that this is a method that worked for me. Okay, so when I applied for residency, I employed this method to prepare as best as I could. And that's something that I think is like that's something I believe in, is that you should prep for it. And so when someone tells me there's no way you can prep for an interview, I don't subscribe to that. I don't believe in that. I just don't. I think you need to prep in life as best as you can for everything. So for an interview, I believe you can prep. And I'll give you an example, actually. You know, I was working as the chief health officer for a number of years at a community health center here in the Kansas City area, and we had a medical assistant who was a kid. I mean, this was a 19-year-old kid. Parents immigrated from Mexico. Clearly, English is a second language. Very quiet, very shy, you know, and he was applying for an early acceptance program for undergraduates at the University of Kansas here for medical school. It was a specialized program that targeted, you know, students from underserved backgrounds. And like, you look at this kid, good kid, but I'm like, dude, you need help because you can just tell, like you can tell a mile away, like, dude, you need help. Like I remember I was asking him, like, what color suit are you gonna wear? He was like, oh, I'm gonna wear gray. I'm like, gray? Gray? No, 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 my friend. Oh, no, no. Look, I don't know much about dressing and clothes and things like that. That's not my thing. But I do know, dude, you need to wear black or navy blue. You're not going in with gray, okay? Dude, you need help. We need to sit down. So what happened was we sat with this kid. I say this kid, you know, he's probably 20 by now, actually. But anyway, so I sat down with him, and actually our whole clinic did. The nurse practitioners, some of the physicians, other medical assistants, we sat down with him and we prepped with him. We're like, listen, they're going to ask you these questions. Here are your talking points. Okay, and you can. It was a little bit of a struggle early on, and we sat with them every day after work. Like I did some, other people did some, and you know, and it wasn't looking good for a while. You could tell maybe he was a little overwhelmed, but you know what? Then he started to get it, and then we practiced, and you know what? He got it. He got it. This kid got acceptance to the University of Kansas School of Medicine, and his interview, like, he blew the interviewers away. I'm like, oh yeah, he needed to prep. Okay, so that's another thing. I think, like, me personally, like, I grew up in an immigrant household. There's a lot of cultural things I'm not attuned to growing up. Maybe I'm not so familiar with, and so as a young adult, yeah, I'm in big trouble because there's a lot of things that I'm just not aware of, and you don't really know until you grow up a little bit more. So, so these were things like people need to tell you. So we sat with him, and he got it, and he's going to medical school at the University of Kansas in a year or two. So that was clear evidence that prepping makes a difference. So that's what I'm saying. Now, so this method is for someone who maybe is not a natural people person. Maybe you're an immigrant background. Maybe, you know, it's geared towards that. If someone who's a natural people person, maybe you don't need this. Okay, so that's the caveat with this approach that I wanted to share today. And this is the belief that I think prepping makes a difference. Prepping matters, you know. And the thing is, this is a critical point in your life. Like you just need to do your best. You have to put your best foot forward. So that's basically it. Those are my disclaimers. Any questions about that? No?
I
Oh,
just,
yes,
I,
Dr. Ola.
I find it hard to believe that you're an introvert, Dr. Morel.
Oh yeah, yeah. I mean, I think you know, there are skills that are learned. Okay, there are skills that are learned, and you learn skills as you progress in your career. As far I'm sure, as you all know, those of you who have progressed far in your career, you know, you can attest to. So so maybe it's a skill that doesn't come naturally, but you can learn it, and then on a bad day it definitely shows. So all right, guys, well, I tell you what, let's go ahead and let's pull up our slides here. So, okay, all right. So today's October 20th, 2023, and the topic of our discussion today is how to prepare for the residency interview. Okay, that's what we're talking about. What is the method? How do you prepare? And so I would say that if feel free to interrupt. Feel free. Okay, I think it's really important that you guys participate and share your ideas, because I can assure you, I'm further removed from being interviewed from residency than you are. You have more recent, more valid experience, so that experience is very valuable, that I would encourage you to share. And that is something I am not able to share. I can share from 20 years ago, but more recently, I think one good example actually was COVID. Like when we did this the last couple of years, it was during COVID and it was all virtual. So then there were the etiquettes of how to do virtual visits. So that's an example of how participants really contributed for the benefit of the group. So so good. So as far as our main agenda items, what we really want to cover today is we need to understand what is the number one question residencies are trying to answer. Okay, we need to understand that. What is their number one question? What are they really getting at? Every question, practically speaking, is really one question. So what is that question? So we'll address that. We will cover the importance of nonverbal communication and what are the few components that comprise nonverbal communication. So we'll discuss that. Next, we'll discuss what's the actual method of prep. Like what do you do to prep? Okay, so we'll review that. The next is practice. Well, we can do an exercise. We can practice generating bullet or talking points. All right. So we'll do an exercise or two. Next is we'll address the fact that, or the concept that an interview is really a two-way interview. You are interviewing them as well as they are interviewing you. All right. So we'll address that concept, and then some like miscellaneous extra topics. So that is what we will cover today. And again, I would encourage you to feel free to interrupt. It's fine. Just interrupt if there's something you want to say. I'll try not to ramble. So, all right. Does that sound like a plan? Anybody else have any extra agenda items? No? Okay. All right. Well, let's move on then. So, okay, what is the number one question residencies are trying to answer? Who would like to answer that question? Yes, Dr. Sartak.
Is this person going to be a good fit for our program?
Excellent. So elaborate for us a little bit more. What does that mean, good fit? Well, like what are people thinking of?
So I'm guessing the program leadership who's interviewing you would be keeping in mind, like, is this person, their overall profile, given their background as in their STEP scores, their medical training, and who they are in terms of interpersonal communication, in terms of their their friendliness, in terms of sometimes they even ask you what their hobbies are or stuff like that, and yes, a few 2-3 interviews of 20 minutes is still not enough time to gauge, but they still are very structured, planned interviews. So they try to get the overall picture of the candidate as to, is this person going to be a good fit for what our program believes in, our program trains, and what our program expects from them in return as well. So truly, in the sense of the word, is this going to be a good match? Pun intended, no pun intended, whichever way you want to say that. So is this person that I'm interviewing going to be a good fit for my program, or my colleagues, or the residents that are already there in the program, and the overall culture of the hospital, the organization, sometimes maybe even the geographical region, depending on certain unique cultures of the geographical region. So yeah, that's why sometimes, lately, the last 2 years, there's also a preference that you can put in areas regarding geographical region, because and also programs usually, sometimes, if not every time, may prefer or may give a little extra value to candidates who have some ties to the program. Of course, not all programs do, only some do. So overall picture that they try to build of a candidate as to, is this person going to be someone that will enjoy us as much as we would enjoy training them?
Absolutely, and if someone is not a good match or not a good fit, then that person will be problematic, So like you said, is this person going to be a good match? Like, as a program, if I'm pretending to be a program, we're a very friendly program. We're family medicine nice, for example. So is this person going to be as friendly and as nice as we are? Is this person going to be, we're all very hard workers, okay? We don't have a lot of tolerance for slackers. Is this person going to match that, okay? Is this, we all check our emails on a timely fashion. Is this person going to be like that? Or is this person going to be problematic? Because problematic residents are time consuming. And what they want to do is they want the program to roll. Okay, we need the rotation to go. We need to take care of patients. We need to go through clinic. We need to roll through this. We need to progress and learn and grow. Okay, we need to teach the junior residents. We need to keep going. We need someone who's a good fit in this machine, so that we can keep going and accomplish, our goals as a residency program. If someone is problematic, they have professionalism problems, they have work ethic problems, they're performance problems, they're so time consuming, and that's the last thing that they want. All right. So yes, they're wanting a good fit, and every question is geared towards this. Is this person a good fit? So that is what everyone needs to keep in mind. One experience that I have, I remember I remember being a part of a ranking meeting, and and people like focus on some of the funniest things, actually, and not most of the time, but sometimes, and it's like, I don't know, that's not very you can tell people have a lot of license to determine if to express if a candidate is a good fit or not. So anyway, that's the number one question. So does anybody have any questions about this? So we'll see when it comes to the actual interview process. We'll try to tie this in, okay, to the actual interview process. But first, before talking about the actual interview, let's talk about what a successful interview looks like. And this is especially when it comes to nonverbal communication. So if I were a fly on the wall, okay, if I'm a fly on the wall in an interview, okay, and let's I'm not even hearing the answers. I'm not even hearing the questions. All right. To me, a successful interview has a few components to it. One is that the person being interviewed, the interviewee, has excellent nonverbal communication. And we'll talk shortly about what that nonverbal communication is. It's how you're sitting, how positive you are, how engaged you are, all right, without even talking, all right, without even saying anything, how positive and engaged you are. I remember one time interviewing it wasn't residency, but a receptionist. I was interviewing a receptionist, and the receptionist, as she's being interviewed, she has her legs crossed and her arms folded like this. So she's got her arms folded and her legs crossed. You tell me, is this person engaged and open and communicative? Yes or no?
No, I don't think so.
Probably not
Classic.
much.
Classic closed body language. It's like, I will never hire this person. Never. Okay. This person is closed, not happy, not wanting to communicate, quite frankly, grumpy looking. Even if she wasn't grumpy, she comes off as grumpy looking. It's like, I would never hire this person. Okay. That nonverbal communication says it all. In fact, I don't even care what she says. And you see this a lot in different people, all types of people. Like, I don't even care what you say. This says it all. So the nonverbal communication needs to be great. Now, this is, I will acknowledge this. These next couple points are a little controversial. So feel free to express your thoughts on this. My opinion, and it's just my opinion, is that the interviewer should be talking more than the interviewee. That's just my opinion. I think when the interviewee if the interviewee dominates the conversation, that doesn't bode very well. Now, just overall, I think that the interviewer is maybe not getting all the questions that they wanted. Does it really take that long to answer the question? The interviewer might be getting bored. The interviewer might, their attention span may be only so long. I don't know. I think it's unusual for the interviewee to dominate the airtime and for it to be a successful interview. That's my opinion. For me, and so again, it's just my personal opinion. If I'm talking a lot, that's not good. My interviewer needs to talk maybe a little bit more than at least. So whenever I say that, I it's a little controversial. My theory is that your answers, again, if I'm watching an interview but I'm not hearing the words, if the interviewee is giving answers that are concise, high yield, impactful, concise, that's the kind of answer that you want to give. And because they're concise, then automatically you're not going to be talking more than the interviewer, usually. Now, the interviewer, if the interviewer is good, they will make you talk a lot. By the way, if you're ever an interviewer, you are going to do it in such a way where you're going to get your interviewee talking as much as possible. But if you're the interviewee, what you want to do for residency, okay, you want to give concise, succinct, impactful answers, and that's it. All right. I also think that, when someone is interviewing for residency, they are seeing someone who's going to present patients in the future. Is this person going to spend forever talking and not really getting to the point when presenting patients? Or is this person going to present patients in a succinct, concise, high-yield fashion? You probably want the latter. So for a future resident, which one do you want? I think you want the latter. So that's why that's my personal opinion, that you really want your interviewer talking at least a little bit more than you, and you want to give your concise answers. And here's the thing, your communication, again, it's not all verbal. A lot of it is nonverbal. When you are communicating, it's the stuff that you say, but it's how you handle your body language as well. let your body language do a lot of the talking for you too, while the interviewer is talking. So that is a way you can still make you make a positive impression even though you're not talking. So I just don't think you should be talking more than the interviewer for these reasons. So anyway, what do you guys think about that?
I have a question. So in your opinion, how long do you think you should keep your answers to? Because I've heard like on 2 minutes or a minute and a half.
Yeah, I think if I'm talking for 5 minutes, that's probably a little too long. I think what you want is talking points. If ever you see politicians talk, they have talking points. And that's what you want to do, is you just want to deliver your talking points. If you deliver your talking points, presumably you have well-formulated talking points that you're going to share, that will rein in your airtime. So you don't necessarily keep track of how you're talking. You're focusing on delivering your clear talking points. If you deliver your clear talking points, then that's all you need to do. And that by itself will keep your response organized and clear. Okay? So, and that's what you want to do. Dr. Ola, you had a question?
Yes, I have a question. So I've heard some people encourage the use of gesticulation, the hands, as part of, I also see that as part of body language. And some people say just keep your hand to yourself and don't let your hand be in the camera.
Yeah.
So I just want to know your thoughts on that.
Okay, well, good question. Let's open it up to the group. So group, hand gestures. What is your opinion on hand gestures? Whoever wants to jump in.
So I remember from last time, because we were split on this too. I was saying that I'd rather keep my hands to myself because I feel like it can be distracting if I'm seeing a lot of hand motions if it's virtual. But I know you were saying that you don't want it to be over your head because it looks like you're getting exasperated, and there are people that are more expressive talking with their hands, and you want to keep it like, I guess, chest level, something like that.
Right. Other thoughts?
I would like to say that maybe for a fractional percentage of the time that an interviewee is speaking, maybe they can bring up just like this, the level to which I'm bringing up, just a little bit. And I don't know, it's very hard to plan it that well, but that's basically what practice would make you a little bit better, that only for the most relevant points that you may have to kind of add a little more stress on it, that's when you may have to kind of just raise your hand, just to the point where it seems like you are adding a little extra importance to the point that you're sharing, but not, as Dr. Ettore said, not to the point where, you know, you're raising it and you're adding a little more drama to your conversation. Not to that point. Very minimal, well calculated points, well calculated times, maybe 2 or 3 times only, and that should be all, I would say.
Okay, good.
Maybe not more than 1 or 2 or 3 times at the most.
Yeah, good. Any other thoughts on that? So I think, sorry, go ahead, Dr. Ettore.
You can go ahead.
Dr. Jaya?
Oh yeah, I feel like when you're using hand gestures and stuff, it is very expressive. I think also because I did medicine in Italy, and Italy, we're famous for our hand gestures. Yeah. So I feel like it's now like a part of me. Right. And but I do agree, I guess at times that could be too much as well. I would keep it to a medium as well, not exaggerated or anything.
Yeah. So I think, for nonverbal communication, we should really put on here hand gestures ? So I will tell you that one of the things that interviewers are very perceptive on is how passionate you are about something or how excited you are about something. Interviewers pick up on that very quickly. So especially when you're talking about like the specialty, if you're talking about the specialty and you're very excited, that is something that they remember and it makes a real impression. So I would say that hand gestures can definitely work in your favor to do that, okay? If you naturally use hand gestures, then use it, use it. I think that generally when you have the palms of your hands open, it's hard to show in the video. If you have the palms of your hands open like this, and you're talking and you're expressing yourself, and that generally helps to make the interview dynamic. It helps you to emphasize what you're trying to say. And it can convey enthusiasm and passion, and people recognize that right away. So I can tell you personally, I feel like it was beneficial, okay? And I did not feel the need to restrict myself, okay? There are some limits, there's some boundaries. So if the hand goes above the head, that's a little too much. That usually is not, actually when the hand goes above the head, it's usually not a positive emotion, to be honest. It's usually an emotion, like Dr. Atoro was saying, you're usually bewildered or exasperated or frustrated. That's when the hand goes above the head, actually. And when the palms are open, that is openness, okay? And that's what people want to see. Remember, it's the opposite of arms crossed. The opposite of hands crossed are arms open, palms open, So anyway, I believe that it is, overall, it's a positive. So you don't feel like you have to lock yourself down. You really want to communicate and express yourself so you can connect with the person. And so, that's what I would say. So, yeah. But let's not forget the other types of nonverbal communication. So the dress professionally, we don't need to talk about that. We all know we're not going in jeans. So we don't need to spend time on that. But these are the big three. These are my big three. You need to sit up straight, You need to maintain eye contact with the person, okay? And so if it's in person, you need to maintain eye contact. You need to look them in the eyes, okay? That's my suggestion. And you need to smile. You need to smile a lot. You need to smile at all times if you can help it. You need to keep smiling. So you sit up straight, you look them in the eyes, and you are smiling. That is what you are doing. And if it's uncomfortable, I'm sorry. You need to get used to it, okay? I'm not joking. So again, I think for some people, kind of back to that original disclaimer, if people are a natural and they connect with people easily, then that's all fine and good. But me, who needed to learn like different cultural norms, who it's not, your culture does not, you're not used to looking people in the eyes, you're used to looking down a lot out of respect. Throw that out the window, okay? Look them in the eyes and you're smiling and you are sitting up straight. That shows a level of confidence and readiness to proceed with the interview and readiness for the next question. So you sit up straight, look them in the eye, and smile, okay? And you do that the whole time, all right? So those are the big three that I would emphasize. Somebody said something in the chat. What is it? Gotta practice smiling. Yeah, you gotta smile. You gotta smile, okay? You need to smile. It's very important. So like when I'm in an interview, I'm thinking, okay, this is what I'm gonna do. I am gonna focus. I am going to consciously focus on my body language so that I'm sitting up, smiling, looking in the eye. Yes, Dr. Leafy.
Hi, Dr. Murray. Thank you for your talk. I have a small question regarding the dress. So in the beginning, you mentioned that there's a medical student who said who will dress in gray suit, and you said it's not very professional. I just wonder if the gray is a good color to wear, because I happen to have a gray suit.
So guys, okay. So I will say dress is not my thing. I advised him as a 19-year-old male. So it was very specific for that. The other gender, that is not my thing. I am not qualified. So I would ask the group, you know, any recommendations for Dr. Leafy?
I say black is, you can't go wrong with black, like a black suit, but there's nothing wrong with some color as far as it's not like too overly bright. So, I mean, gray just seems drabby, to be honest. You don't want to do gray and then put a black suit on a gray.
My wife tells me that. That I know. My wife tells me, don't match gray and black. That I can.
Right.
Yes.
So, a little, I mean, I'm not fashion either, but I know if I'm going to do black, I need a little bit of something to contrast it, not gray. So.
Okay, thank you. So I think I will just wear a white shirt with gray suit. I think that should be okay.
Yeah, white and black. If you don't know what to wear, white and black, standard.
Yeah, thank you.
Anybody else have any fashion tips?
I'm sure if she goes online and search for what to wear, female attire for interviews, I'm sure she'll find some useful tips. There are a lot of them online.
Yeah, and see if you can have maybe somebody else comment, take a look at it too. If somebody else takes a look at it, the planned attire, maybe someone else can, you know, give some comments as well, just in case, you know, that I found that to be helpful. You know, it's almost like a personal statement. Have somebody else look at it, you know, so.
Thank you so much.
Yeah. So good talk. So, okay. So, all right. So we need, when we come out of this, we need to know the big three for nonverbal communication. What is it? It's on the screen, but what is it?
Sit up straight, eye
Sit up
contact,
straight.
and smile.
And smile, yes. Okay. Those three. Keep those three the whole time. All right. Actually, one time I had an interview, and this was to the program I matched to, actually. So right before I walked into the interview, somebody gave me Hershey Kisses. You guys know Hershey Kisses, right? You know, they're trying to be nice. Welcome to our program, you know, trying to be nice. So they gave me Hershey Kisses. So I had it in my hand right before walking into for the interview. So then I sit down for the interviews with the program director, and I had these Hershey Kisses in my hand, and I'm trying to put them somewhere. Like, I don't know where to put it, you know? And then it was too late. She started asking me questions. So I was like, okay, I don't know much, but I do know I am going to sit up straight, and I am going to smile, and I'm going to look at her in the eyes. And so guess what happened to the Hershey Kisses?
It melted.
They melted.
They melted.
They melted. It was so horrifying. They melted in my hands as the interview was proceeding. But you know what? Because I looked her in the eyes the whole time and I smiled, she didn't even notice. It was amazing. And then I walked out of the interview and I had to wash my hands. So anyway, had I not focused, then who knows, maybe I would have fidgeted. I would have, you know, I may have caused a distraction for the interview, and it may not have been good. But by focusing on my body language, it kind of helped me to focus as well. So, and if you do practice in front of the mirror, practice those things. You got to focus on, like, look in the eye, smile, sit up straight. Okay. Any questions on this part?
I gotta add,
Yes.
because we make a point to mention this, because I think this cycle, there are some programs that are doing in person as well as virtual. So if you're doing virtual, make sure you're looking at the camera hole. to maintain eye contact rather than looking on your screen, to look at the person. So that will reflect on your screen that you're maintaining eye contact. So the little green light on your computer is your target. If you could just, as you're answering your questions, just look at that. But if they're talking to you, you can look at your computer screen to look at them. So.
Absolutely. Thank you, Dr.
Yeah, and this is something that, once again, only with practice, maybe practice doing FaceTime on your laptop or something with a friend and looking at the green light instead of the screen. Something, I don't know, whatever works for everyone. This is easier said than done. You know, actually looking at the green light while you're talking and not looking down at the screen. So yeah, with people with having various times of interviews, you know, multiple interviews coming up, the sooner you practice this, the better it would actually be. So
and you know, after we talk about prepping, you probably want to practice in some fashion. Practice in front of a mirror, practice with your laptop on and the green light on. That practice makes a big difference, okay? Because essentially you're about to perform. So it's just like someone giving a speech or performing a musical instrument or doing a presentation. You're going to perform. So some practice goes a long way. Don't fall into the I don't suggest, you know, to fall into the trap of, well, I'm just going to go in, I'm just going to do my best. No, practice, prep, but then practice after you prep. And that's something that, you know, we probably haven't emphasized a lot previously, but it's it makes a big difference for you. You come up, you'll be more natural. So good. Any questions on nonverbal communication? So when you're not talking, this is what you're doing. You are doing this. And you know, as you progress in your professional career, like so much of your communication is nonverbal, so much of it. So don't underestimate how important it is. So, okay. Any questions on this nonverbal? Okay, all right, very good.
I have a question.
Please.
So on the topic of looking at camera, I'm just wondering, I'm a kind of person that as I'm talking, I also like to see the body language of the person I'm talking to, or their facial expression, or how they're responding to what I'm saying, to also like adjust on the fly. So if I'm just looking at the camera, so do you advise looking at the camera the entire time, or just look at the face of the interviewer just in between? So so that's my question, or that's what I'm like worried about.
Yeah, good question. What would you guys have to say?
I have a suggestion.
Yes, Doctor.
So I've tried this before. It kind of worked for me. So like, what you can do is you can shrink the screen and drag it all the way to the top of the page, and so it's like closest to the camera, like just a little bit underneath. And so your sight is right under it, but it looks like you're looking at the camera.
Okay.
That's a nice hack, for lack of better words, I would say. The only thing is that if you minimize and push it all the way to the top, you will be seeing very little thumbnails of the interviewers as well. So that's the trade-off you will have to do if that is the trick you want to
Yeah, I mean,
do.
you just need to see their face a little bit just to see their expression. I mean, you don't need to see their whole body.
Okay.
So
thanks for that answer.
Yeah, good one. Yeah, thank you,
I'd
Dr.
like to add.
Please.
So for me personally, I tend to react to what the interviewer is doing, and sometimes that can get in my head and I can lose my talking points. So I remember one time I interviewed and she was taking notes. So I was like, oh my God, I wonder what she's writing. Did I say something right? Did I say something bad? You know, it just got in my head and I lost my talking point and I couldn't recover. And it's just, well, if you feel comfortable trying to see how the interviewer is reacting to what you're saying, then you can, you know, if you do a quick glance back to your main screen, just a quick glance every now and then, is not very distracting. And I just rather just look at that little green light, and once I'm done with my talking points, and they will say, okay, thank you, and then I'll look back at them on the main screen. And as well, but yeah, and also be careful though, because if you don't maintain that eye contact with the screen, your eyes, if your eyes are wandering and you seem lost, they're gonna pick it up too. So
thank you.
Good points. Any other questions on nonverbal communication? Okay, all right. Well, if there's nothing else, we can move on, I think. So let's go to, all right, let's go to the actual prep itself. So here's the thing. When people ask questions, you want to give talking points, okay? You want to have these points that you have thought of ahead of time, and you just want to deliver those points. Point 1, 2, 3, and that's it, okay? So that's how you want to answer the questions. You don't want to give like long answers that may or may not answer the question. You want to give concise bullet points or concise talking points that address the topic of the question, okay? So that's your goal, to deliver point 1, deliver point 2, deliver point 3, and that's it, all right? That's all you want to do. You want to give concise answers. So that's the goal. That's what you want to get to, all right? The way to prepare for those is as follows. What I do is I sit down and I think, what are the 10 questions they're going to ask me? And generally speaking, it's not a mystery. You can pretty much guess what they're going to ask you, all right? So this is an example of 10 questions. So tell me about yourself. Why this program? Why family medicine, which is the specialty? Why the specialty? Tell me about a difficult clinical situation that you had. Tell me about a difficult patient situation that you have, you know. Tell me about a time you did not perform well and how did you handle it? What are your strengths? What are your weaknesses? What are your future plans? What do you do for balance? Like, what are your hobbies? How do you relieve stress? You know, and you could probably think of other ones, but just think to yourself, what are the 10 questions that I am going to prep for? Okay, what are the 10 questions they're most likely going to ask me? And what I do for every question is I write down 3 bullet points, maybe 2, maybe 4, but basically 3 bullet points. And what I do is maybe even 1, okay? It may even just be 1 bullet point. And for each bullet point, I think, what talking point do I want to convey? Okay, what do I want to say for this question? And then I just write down a few words. I don't write out the whole thing. If you write out the whole thing, you're probably doing something wrong. So one question, like I talked earlier, right? I had a death in the family during med school. So maybe someone will ask me, tell me, tell me a time you had a difficult situation. Then I can say bullet point number 1, death in family. Bullet point number 2, struggled with exams. Okay. Bullet point number 3, how I recovered. Okay. And then so those are my bullet points, just a few words. And I just remember those few words. And then when they ask me the question, then I can elaborate more and it comes off as more natural. But I remember the key, I remember just those few words for each bullet point. And I do that for every question. So question number 1, tell me about yourself. I'm going to think, okay, what about myself do I want to say? You know, what med school I went to, you know, how I, you know, volunteered in free clinics, how, you know, I thrived in family medicine. You know, those could be 3 quick points. Question number 2, why this program? Location, culture, special clinical tracks. Okay, so then I can say, well, you know, so why this program? I can talk about how this program is near to where I grew up, and it's a program that I believe I can connect with and would be ideal for training. And this is a program I know from other previous residents who have talked about what a wonderful culture you have, and that's the kind of environment that I want to learn as a resident. And in particular, I'm interested in the clinical tracks that you have in rural medicine or OB or geriatrics. And these are things that I would like additional training in because I see myself doing this in the future. Okay, there you go. So bullet point number 1, location. Bullet point number 2, culture. Bullet point number 3, clinical tracks. And then I can expand on it. And then I have something called cap it off. Whoops. I have something called cap it off. And what cap it off means is that after I deliver my talking points, I cap off my answer by saying, for these reasons, I believe I would be a great fit for your program. Okay. And if I say that a couple of times, maybe I say that 2 times, I would be a great fit for the program. I've repeated that multiple times. And if they like me, then they'll come out of that interview saying, you know what, that Dr. So-and-so, I think he would be a good fit for our program. Because it's sort of like I planted it, you know, I planted it in their mind saying, I would be a great fit for your program, okay? Now, of course, your answers need to be legitimate and convincing and so forth, but that helps to drive home the point. So I deliver my talking points, and then I cap it off saying, for these reasons, I believe I would be a great fit for your program. So this is the structure of my answer. So I have my questions. For every question, I think of 3 bullet points, a few words for each bullet point, and then I cap it off. And I do this for every question, okay? And then I have it on a piece of paper, and it looks sort of like this. So I have a 1-pager. This is how I do it. Now, I'm very meticulous. Okay, I'm very detail oriented, unfortunately, in some things. So very meticulous. Maybe you don't need to do this. Okay, I acknowledge not everyone needs to do this, but for me, I like doing it. So for question number 1, I have my bullet points, number 2, and so forth, and it all fits. It all fits on one piece of paper, on one side of a piece of paper, and I study it. Okay, I study it, and it takes me like 45 minutes to review it. And after I've reviewed it and studied it, I'm ready to go. I am ready to go. And I can practice it in front of a mirror. Like I can ask myself the question and I can practice delivering the answers. And I can practice that nonverbal communication like we talked about. But this is how I prep for the interview. My experience is that many times they will ask me exactly what's on here. Okay, like I essentially made myself a cheat sheet. So they will ask me most of the time exactly what's on here. But even if they don't ask me exactly what's on here, just doing this exercise really prepared me well, okay, to answer the question, even if it wasn't on here. All right, so that's how I prepare for it. Okay, so before we do an exercise, any questions on that? Let me ask you this. What other methods of preparation have people done? Anybody want to share?
I think practicing with other students would help a lot, or with someone. I wouldn't say like every day or something, but I think it would be a good start. I feel like it's helped me, like practicing it with someone or a group of students, mock interviews, all those.
Yeah, absolutely. Good. My suggestion is if you do this exercise, do it before you sit down with somebody. Do it before you sit down with somebody. And then actually you can fine tune your talking points. And what's interesting is that, you know, you get better interview to interview actually. So your first interview, you do this, and then you're actually better the second time. I remember I had, you know, a few interviews, and I remember the later interviews, I felt like a politician because I was just delivering talking points to different questions. And that's how it should feel like, to be honest. I think if you're doing it like that, then it's a good sign. So good. Anybody else? What other methods of prep have you guys done before?
I have recorded myself and then play it back.
Ah, very interesting. And how do you feel that helped?
It's good because then I can see things I can improve. When I go blank, I can see how I react to it, right, and how I recover. But the thing is, I don't like hearing myself talk, but I have to practice.
Yeah. It's
good to hear yourself respond back and to see how that nonverbal communication and how it comes across.
Right, right. Yeah, very interesting. Yeah, I can see how that would be helpful. Absolutely. Good. Anybody else? Anybody else have any prep methods they want to share?
I'm thinking of recording myself, my answer to interview questions, and sending it to like mentors or friends or people, just like text it to them, like 2-minute answer, and get feedback from them. So that's another thing I'm thinking of.
Yeah, wonderful. You know, one concept that I like to share about this is that your answer, the actual answer itself is not as critical as you think. I think if you give a reasonable answer, but you deliver it well, you know, you articulate it well, you're succinct, you're confident when you say it, you know, the way, if you deliver it well, that's just as important as the actual answer itself, okay? So however you prepare so that you can deliver your answers well, that should be good preparation. So for me, I know, like, for example, I have a tendency to ramble if I'm not careful. I'll ramble and, you know, it's awful. So this method helps keep me in check. I'm able to give succinct answers. And frankly, if I thought about these questions ahead of time, then that makes my delivery better. So it helps keep me in check at the time of the interview, but also it's a good exercise so that I'm thinking about these questions ahead of time, as opposed to thinking about them for the first time during the interview, you see? So that's how I feel this method helped me. So let's go ahead and let's do an exercise, shall we? So what question do you guys want to answer? Let's prep for a specific question. Pick a question. What question do you want to do?
Can you go back to the your question list?
Oh, sure.
Please.
Sure. This is just a sample, by the way, but yeah.
I think the most common one, it will always be tell me about yourself, as simple as that is.
Sure.
Sometimes it feels weird talking about yourself.
Absolutely, absolutely. So the other concept about the interview is that this is one of the few times in life where people want you to talk about yourself, okay? Normally in everyday life, your goal is not to talk about yourself. You know, your goal is to talk about like whatever your job is, or you're working on something, or you're working on a team, or you know, you're not talking about yourself typically. This is one of the few times to talk about yourself. So you know how people humble brag, they like talk about themselves. I mean, I guess we all do it at some point, but you kind of talk about yourself. I like, oh, I went on this vacation and oh, I'm so tired. I went to Italy. Did I say Italy? Dr. Chai. I went to the Bahamas. I'm so tired. So what that person is saying is they went to the Bahamas. They wanted to communicate to us that they went to the Bahamas, okay? So it's sort of a similar thing in interviews. It's like, what do I want people to know about me? So this is your prime time to share what you want people to know, okay? So tell me about yourself. Tell me about yourself. So guys, just about everybody here is an assistant physician. Just about everybody here, right? Everybody? Yeah, everybody. So dude, I'm sorry. Like you better put assistant physician in here. Like you better put it. Like if you don't put it in here, something is wrong. Like, so that is a talking point. Like so if you sit down and think, what do I want the program to know about me? I want them to know that I am currently practicing, okay? And all the stuff I do as a practitioner. So you can maybe just say AP, okay? All right, number 2. Okay, that's one talking point. What else, Dr. Arturo, is it okay to use you as an example?
Sure, yes.
Okay, all right. So, let's see, what do we know about you, Dr. Arturo, that we want to highlight? Like if I'm Dr. Arturo, AP has got to be one of them. What else do we want to say? So you are applying where? You have an interview, if I'm not mistaken, Birmingham, correct?
Gadsden, yes.
Gadsden. Oh.
Yeah. Oh, hometown turf, because I did.
Yes, exactly. That's what you want them to know. So you grew up, that's close to your hometown, right?
Yeah.
See, that's what you want them to know. Okay, what specialty are you applying to?
Family medicine.
Family medicine. Okay. Real quick, this is just a quick and dirty. This is what I would say. This is what I would say. So you're close to the program, so you wanna highlight the location. The assistant physician, you want to mention that. And then the fact that you thrived in family medicine. I think that's a common one that I would recommend doing. So Dr. Arturo, why don't you, so if I'm prepping, these are my 3 talking points, okay? So why, and I'm going to practice delivering these. So why don't you ask me to tell me about yourself?
Okay. All right, Dr. Mard, why don't you tell me about yourself?
Absolutely. And so I think the first thing I would say is that I grew up not far from this program, and it has always been an aspiration of mine to complete my training in a community that is close to my own. Currently, I can tell you that I work as a licensed assistant physician. Since graduating medical school, I became licensed to practice in a charitable clinic as well as an urgent care where I see patients independently, I construct their office notes, I prescribe medications, I order labs, I order imaging, I perform office procedures, all within a family medicine setting. And what I learned about myself is that I thrive in a family medicine setting. And that's why I am so excited to apply to this specialty. And for these reasons, I believe I would be a great fit for your program. Okay? Like that's more or less. So the thing is, I'm smiling. Hopefully, was I smiling? You smile, you look, stand up straight, and deliver. Okay? And then cap it off. So, and then you're done. Okay? And then they're going to say, oh, wow, tell me more about being an assistant physician. You really need to weave in assistant physician into your answers, like in every answer. Okay, you need to get that in. They may only ask you 3 questions, okay? During a 10-minute or a 30-minute interview, they may only ask you 3 or 4 questions. You need to weave in assistant physician every chance you can get. You need to tell them that you're already practicing. So anyway, those would be my talking points.
That was good.
So the thing is, you're local, you're an AP, and you love family medicine, right? But why do you love family medicine? It's because you practice in a family medicine environment. Okay. Now look, everybody has their personality. You deliver it your own way, but just deliver it. Okay.
Right.
Deliver it your own way, but just deliver it. Okay. Okay. Let's do another one. Who wants to do another question? Okay.
But just
Dr. Morid, I have a question. Please.
Yes.
Yeah, so in practicing with some friends, they mentioned something about talking about outside medicine, you do this, or hobbies while talking about tell me about
Sure.
yourself.
Sure.
So do we need to include that in tell me about yourself?
Oh, no. Well, I mean, how would that, so I'm biased. I would save that for the like they're going to ask you how you deal with stress. So like, that's another question. It's a very well-established question. So I think if you do include something personal, you can say like the tell me about yourself, you can put in there, I'm married and I have 2 kids. Okay. Like I might do that, but like what hobbies in particular?
Can you fit me? Like talking about oh I like to play basketball or something like that outside of medicine.
Yeah, it could be okay, but I admit I'm a little biased. So there, you know, like unless you know, I think it would be, I don't think it would usually be something I would include in there. I think like it needs to be, because when they're interviewing you, they care more that you're able to function as a resident than they care more about your hobbies, to be honest. I think the hobby question is more so like, are you normal? That's when they're asking about hobbies. Like, are you a normal person? Because we don't want abnormal people here. So I feel like it's just a different question. When they say, tell me about yourself, they're like, it's more so, can you function in our program? Like, would you be a good fit in the sense that, would you be able, like, will you be able to see patients in clinic, or are you going to fail right away? Are you going to be a disaster in the hospital? Like, are you going to be able to function here and succeed here? The fact that I go mountain climbing doesn't contribute to that as much as I was an assistant physician. I have a connection to this place. I love family medicine. It's more important than I go mountain climbing. I think if you're doing 15 talking points, yeah, maybe. But I just don't think. What do you guys think? I just think, I'll just say, I think it's a separate question, because they're going to ask you, what do you like to do? So I save it for that. Yes, Dr. Nenna.
I actually have a question to ask in addition to what Dr. Ife talked about.
Yes.
What do you think about adding, this is tell me about yourself, right? Where you were born, where you've lived, and where you trained, and then how people describe you. How does that sound when you're describing yourself?
Yeah. What do you guys think about that?
I think that if you have an interesting background, that you should talk about it. For people that were not born in the United States, I think you should talk about how you ended up in the US, briefly though. And I think that usually leads to more them asking you more questions. Oh, and then they're interested about your background and all that. But I would include that part. That's what I think.
Yeah.
Small kind of adding a little. Read that they ask you a question. takes you answer to that question. The next answer, which is interesting, make sure that it done questions would actually paint a picture, I would say.
Dr. Sartak, I'm sorry. I think for me, you're cutting out.
Yeah.
Oh, I'm sorry. Anyone hear me right now?
It might be better now.
If you and if the interviewer asks details regarding that you are ready with a follow-up answer, it could come something you already shared, and the overall chain of details that you shared is positive regarding you that you could paint in your.
Sorry, Dr. Sartak. I think it's still cutting out, still breaking up, unfortunately.
No, just you may want to go out and come back in and see if that helps.
Okay.
That should work. I would say, so the first thing that comes to mind when you say your place of origin, like, let me tell you something. My residency, so I'm originally Egyptian. My residency, I don't think that helped me out at all. I'll just be honest. I don't think that was helpful at all for them to know, you know, because it highlighted my deficiencies, to be honest with you. It's like, because I was very like young and I was very like, there and you know, I alluded to some difficulties I had in med school, and it wasn't easy. So it just highlighted the fact that you are like, you have a long way to go. And I don't think it was helpful. I think if you do mention like where you're originally from, you need to follow it up right away with, but here's all this experience I have in the United States. So like where I'm, you know what I mean? So if you say where you're from, where you went to med school, and then you say, but you need to make sure you highlight your clinical experience here afterwards. I think that would be important. Yeah, Dr. Jaya?
Yeah, so I think I understand what you're trying to say, Dr. Murad. Once I actually spoke to a program director, and one of the things that he said was that, so I mentioned that you know, my roots are from India, but I was raised in United Arab Emirates. I went to school here in Italy, and then I came here. So one of the things that he said, like in a positive manner, was the fact that you've seen different healthcare systems. You're someone who is able to adapt to changes and you've seen like different settings. That was one thing that he said is a positive thing. So he said, like, you know, that shows like a program director, okay, it seems like you're someone who you know, even if you're like the residency who's inviting you is not from your hometown, that you are someone who can adjust to like or like live far from your family, for example, or, you know, that kind of thing. So that's like one thing that stood out.
Okay, wonderful. Yeah.
I will add to that. If you'd like Dr. Jared said, if you do mention it, you have to, whatever you say has to have a purpose behind it. Just don't throw things in there just to say it. Highlighting a place of origin, like she said, will show the adaptability. I think it will show like a diverse of culture and experience. Now that a lot of programs are looking for diversity and equity, you know, it could be something that will play positively.
Yeah. Yeah, I want to agree with that. I think that if you do talk about your place of origin, link it to diversity. And I agree, don't mention it for the sake of mentioning it. Have a purpose. So the thing is, these talking points, you need to pick them. You need to pick your talking points so that, you know, whatever they are, they're highlighting something that you want them to know. So like, if you want them to know that we're from Nigeria, for example, okay, why? Why do you want them to know you're from Nigeria? You can say, now, if you want to tie it into diversity, that would be a reason, but just make sure you have a reason behind it, you know?
Right.
Yes, Dr. Bina.
I think they want me to talk only like 2 to 3 minutes for this topic, because most of the time one interviewer has only like 10 minutes with you, so they don't want to elaborate a lot of time just for this question. So we have to be very prepared, like what we want to talk in that 2 or 3 minutes.
Yeah. So not everybody, the place of origin is going to be very helpful. So just be very like, and just like Dr. Bina said, you don't necessarily have a ton of time. That's why your answers need to be succinct. So you know, pick your points with purpose. Let's do another one. Let's do another tell me about yourself. Does anybody want to volunteer? Anybody want to volunteer, talk about them? Dr. Bina, you still have your hand up. Are you volunteering?
I will volunteer Dr. Ola.
Dr. Ola?
Go ahead.
Okay. Let's, Dr. Ola, Dr. Itoro volunteered you.
Okay.
Do you? So let's think about the points you want. So tell me about yourself. What are the things about you that you want to share?
Okay. One of them being, I grew up in a large family of 14 siblings.
Okay.
That's one talking point. And my other second talking point would be my clinical rotations in the US.
Or rotations, okay.
Yeah, clinical rotations.
Mm-hmm.
And let me see. And also being an assistant physician.
Thank you. I was gonna lose it. Okay.
Assistant physician.
Okay.
And in addition to that, my volunteer experience.
Volunteer. What specialty are you applying for?
I'm applying for internal medicine and family medicine.
Internal medicine and family medicine. Okay.
And I have an interview in internal medicine coming up.
Wonderful. Okay, so you have an internal medicine. Tell me, what does large family, how will that contribute to the internal medicine residency or the interview? Do you think large family will be helpful?
Yeah, I think so.
Yeah. What is the group thing?
To answer that question, I think it's useful because my experience growing up taught me how to be a good team player, and also very comfortable to like receiving feedback from people that are more experienced than I am. And I think that's useful to, to residency.
What does the group think? Be honest. You can already tell what I think, I know, but what do you guys think?
I know, I think you probably think he shouldn't put that in there. I think that it could be like a topic starter. It could be interesting for the interviewer, like, oh wow, you grew up in 14 family, how was that? How was your experience? But it could like lead away from focusing on your AP experience. I don't know.
Let me ask you, Dr. Ola, what other, I'm trying to remember your personal statement. What other professional experience do you have? Like, you graduated medical school how long ago?
I think it's 2011.
2011, okay. So aside from being an AP and doing co-rotations, what else did you do?
I also worked as a research coordinator.
There we go. Now we're talking. Research coordinator, and what kind of research?
So I did hematology oncology research, and right now heart failure research.
And what now?
Currently heart failure.
And heart failure. See, now you're talking internal medicine, you know? Yeah. Now, okay. What else did you do?
Basically that's it.
Really? All 12? How long have you been in the US?
Been in the US since 2014.
Okay. And research coordinator with who?
So research coordinator currently with a community teaching community hospital, community university affiliated hospital.
Which hospital?
Cedar Sinai.
Cedar Sinai? In what city?
In Los Angeles.
Isn't that a famous hospital?
Yes, it is.
Isn't that where like movie stars go to? Oh yeah.
It's the same hospital, yes.
Yeah. Is that associated with UCLA?
Yes. They kind of have some connection with UCLA, but it's totally separate hospital. But most UCLA students go to Cedar Sinai for rotation.
Yeah, I was about to say. Yeah. You need to name drop a little bit.
And I got interviewed in the same hospital.
Good man. Okay. Well, well, so much for name dropping. You're in the same place. Okay, I understand. Okay. Core rotations and what?
So core rotations, I did in cardiology, I did in infectious disease, and also in just hospital medicine.
Oh, beautiful. Yeah. And you did core rotations in the US, is that right?
What do you mean by core rotation, please?
I typed core for some reason. I'm sorry. What kind of rotation?
Clinical rotation, yeah.
Yeah. So then if I wanted to put this in order, then I would take this out. I would just put it here. And so after graduating from medical school, yeah, so
is it also important to mention that I practice unsupervised, like fully licensed in Nigeria before moving to the US?
Yeah, definitely. So what did you practice before moving to the US?
As a general practitioner.
Perfect. And what country?
In Nigeria.
Yeah. Okay. You see, I just feel like there's more important things than a large family. Don't get me wrong. I'm sure it's a beautiful family. But I think this is a professional interview. You know what I mean? They're going to ask you the personal stuff they're going to ask, you know? And let me ask you, and then I was in a large family, therefore I'm a great team player. I hate to say it, I'm very skeptical about that. Like if I'm an interviewer, I'm like, well, I know a lot of people from large families that are not team players. I mean, I'm just very skeptical on that. I think if someone wants to make the case that they're a team player, then I think maybe your experience as an AP would be more convincing.
Okay.
You know, so I'm skeptical when someone says, well, large family is too remote. That's such a long time ago. You were young, you're not in any professional environment in a large family, you know, it's not quite the same. So I'm skeptical on that, to be honest. I think this stuff, like now you're talking, you were a GP, you did rotations in cardiology, hospital medicine, research coordinator, and hem-onc, CHF. Now we're talking. So if you wanted to have talking points, you can say originally from Nigeria, you know, originally from Nigeria, you know, worked as a GP, you know. So this is something that I would look at it this way. Okay, so go ahead, Dr. Ola, and why don't you ask me, why don't you ask me to tell me about myself? I'll pretend to be you.
Okay. How are you? How are you doing, Ola?
I'm great, thank you.
Okay, okay. It's nice having you, and you're actually the first person I'm going to interview today, and I'm interested in knowing about you. So, how about you tell me about yourself?
Absolutely. Well, the first thing I would say is that I'm originally from Nigeria, and I went to medical school there. And after graduating from medical school, I worked for a few years as a general practitioner in a community where I provided a broad spectrum of medical care. Since moving to the United States a number of years ago, I had the opportunity to participate in a range of clinical rotations, which included cardiology, infectious disease, and hospital medicine, to which I very much gravitated to. Currently, I work as a research coordinator here at Cedars-Sinai Medical Center, where I work on projects that are within the specialties of hematology oncology, as well as research on congestive heart failure. Also, I currently work as a licensed assistant physician where I volunteer in a charitable clinic on a monthly basis where I am licensed to provide medical care, where I see patients, construct their office notes, I prescribe medications, order labs, order imaging, refer to other specialists, I see patients during their follow-up visits, and I provide longitudinal primary care to predominantly an adult population, the majority of which have diabetes, hypertension, and other chronic diseases. These are experiences that I believe would make me a great fit for your program. Something like that. But you would do it your own way.
Okay.
You look disturbed, Dr. Ola.
No, I'm trying to take a picture of what's on the screen.
Yeah, yeah. So that's more like it. Like the fact that so I think part of it is thinking, what talking points do you want? So my suggestion is sit down and think about it. What do you want them to know? Would you rather they know about your family when you were young, or that you worked as a GP? I would argue you want them to know you worked as a GP. So just think, what are the talking points that I want to convey? Okay.
Okay.
And then honestly, you can just say, in order to review it, you could just say GP. You could just say rotations. You can just say research coordinator. And then you just say AP. Okay. So just think GP, rotations, research coordinator, AP. Those are my talking points. That's what I want to convey. Okay. And you know, the beautiful thing, even if you forget something, it's okay, because you're more or less on this track. All right. So it's okay if you don't remember everything, but I'm just going to practice in the mirror. When they say, tell me about yourself, I'm going to practice delivering those talking points. Okay. So somebody has something in the chat. Oh, thanks, Dr. John. And honestly, and remember, it doesn't even matter. It doesn't even matter what your answer is exactly, but you want your answer to be reasonably good, and you want to deliver it. Okay.
Okay.
I just think if we start talking, well, I mean, yeah, so if you thought about it ahead of time, you're more likely to deliver it well. 4 is a lot, by the way. You could do 2 or 3. Anyway, that's fine. If you can remember it. So okay, guys.
I have a question.
Please.
I've heard some people say in the question, in answering tell me about yourself question, that it's not necessary to repeat things that you already have in your CV, that they can already see that is a waste of time. Yeah. What do you say to that?
So you know what? So a common criticism is like if someone says, tell me about yourself, then it'll sound like they're just repeating their CV. What I say for this is that the things you say on here may be on your CV, they may not be on your CV, okay? So for example, so another legitimate talking point you could have here is that you thrive in internal medicine. Like a talking point could be, and I found myself that I thrived in an internal medicine environment, and I was very successful in helping patients, improve, change their lifestyle and improve their chronic disease metrics. And I found this very exciting, and it makes me, very motivated to pursue this specialty, So this is not on your CV. This is a talking point that is not on your CV. The fact that you found that you succeeded in an internal medicine environment or a primary care environment, that's not on your CV. AP, research coordinator, rotations, GP, they may be, okay? So it may, now I do think that it's reasonable to have some things from your CV because you need to explain them. For example, the AP, that'll be on your CV. My suggestion is explain it, because it's not something people are so familiar with. So you want to use the interview as an opportunity to further explain what's on your CV, but explain the things that you want to you want to pick what you want to highlight. Okay, you see what I mean? So it's on your CV and you want to focus on it. So use the interview as an opportunity to focus on it. But again, there may be other things that are not on your CV. So to answer your question, what you say may be on your CV, it may not be on your CV. If it is from your CV, it's an opportunity to highlight and explain it further, because you really want them to know. It is important that they understand what you do as an AP, because what you are doing is more than any medical students right now. I mean, the inpatient stuff you can argue about, actually, but the fact that you are a licensed practitioner independently prescribing and treating, that is more than what most medical students are doing. So you want to explain that. So,
okay.
Yep, Dr. Jaya.
Yeah, basically for Dr. Ola, I just wanted to say, most of the students here, the American graduates, they don't have a license in a state to do like what we're doing as an assistant physician. So I think that actually sets you apart, and that's like your highlight, like Dr. Murad was saying. So even though it may or may not be on your CV, this is a highlight that you do want to tell about yourself, that you don't want them to miss anything. It is basically a bridge to residency. Like you have your foot in it, and you're licensed in a state and practicing. So that is something that you actually want to highlight and say in that first question.
Okay. Thank you.
Yeah. 5 is too many points, by the way. I just think that's too many. Okay, good. Okay, you guys want to do another one? Actually, Dr. Bina, is it okay to pick on you for this question?
Sure.
So Dr. Bina is a labor and delivery nurse. So you better believe we're putting that on there. So she's a labor and delivery nurse. Okay. In a busy hospital in Chicago. Okay. And what else, Dr. Bina? What else do you want a program to know about you?
Okay, one thing is, of course, assistant physician.
Right.
And in the past, I worked as a midwife in Saudi Arabia.
As a what now?
And as a midwife.
Ah.
And assistant physician, and still I'm working in labor and delivery as a registered nurse.
Right.
And,
okay. And right. So something that, go ahead.
Sorry. Okay, so I was not a traditional student, so I took as a non-traditional pathway because I was working. I had to work, and I had like 3 children to raise, and
Right.
so that resulted in I had to take break from med school and work and make my tuition and then go back. So there was a break in my education as well. So I don't know if I need to mention that here or not.
Yeah. Yeah, that might be something. So to mention that, you're a non-traditional student,
Yeah.
the fact that you're an AP, women's health. Where did you do med school at?
UHS, it's the International University of Health Sciences in St. Kitts.
St. Kitts. What's wrong with this? Oh. Okay. I see. Okay. 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 All right. Okay. So that might be, so if I were Dr. Bina, these would be some points I would mention, right? I mean, there probably are other really good ones too. So Dr. Bina, why don't you, if I'll pretend to be you, why don't you ask me to tell me about myself? I'll pretend to be you.
Okay. Hi, Dr. Bina. Okay, so how are you feeling?
I'm nervous.
Okay, you can be comfortable here. I would like to know more about yourself, so tell me about yourself.
Absolutely. Well, I can tell you that I am a non-traditional student. I attended medical school in St. Kitts while juggling a busy family life and a career. Professionally, I've worked as a midwife abroad, and I also work as a labor and delivery nurse in a busy hospital in Chicago that delivers, I don't know how many deliveries a year, let's say 2,000,
Yeah.
2,000, that delivers 2,000 babies a year. Since graduating medical school, I successfully became licensed as an assistant physician in a family medicine clinic where I see patients for office visits, independently prescribe, order labs, order imaging, refer to specialists, participate in a number of office procedures, and see patients for their follow-up care. In fact, because of my aptitude for women's health, I was selected to perform or to conduct women's health clinic sessions where I routinely perform pap smears and breast exams and ensure that patients get their breast and cervical cancer screening, and also address a number of women's health and gynecological concerns. And so this is an environment that I found myself to have really thrived in. I loved working in a family medicine clinic, and in particular, providing women's health care. In fact, I was the only women's health provider in a charitable clinic in the entire southern Kansas City metropolitan region. I believe that this type of experience as a licensed clinician in an underserved area, providing women's health, would make me a great fit for your program. Something like that. But that's what, so that I would do something like that. Okay. I highlighted the fact that we're a non-traditional student, so that automatically accounts for a lot of things. The fact that you're a labor and delivery nurse in Chicago, like, you will do great on labor and delivery. Okay, like, you will do, like, you're already, a good labor and delivery nurse. You're better than a second-year family medicine resident, actually, already. So yeah, you would hit the ground running. The fact that you're an AP goes without saying, and this is very unique what you did. This is very unique. You should say that. You are the only charitable women's health provider in the entire Southern Kansas City area. Only one. You should say that.
I know. Okay, thank you, Dr. Marat. I never thought about it actually. Yeah.
Well, yeah, no.
Yeah.
Exactly. You're the only
The
one.
way-
You were the
Yeah.
only. So you need to say that. So those are the things I would say. So because I'm thinking, what do I want them to know about me? This is what so anyway, that's what I would say. Okay. All right.
Thank you.
Okay, we had some questions here. Let's see. Dr. Ola asked her question. Dr. Ishrath, Dr. Ola asked the question. Okay, we're good. Okay. Okay. Does anybody want to try another one? We'll do one more. Let's do, because it comes up, tell me about your weaknesses. Okay. Who wants to volunteer for this one? Who wants to volunteer here? Anybody? Dr. Leafy. Okay, very good. Okay. Now, Dr. Leafy, question, do you know Spanish?
No.
And that's a weakness. Okay, that's what you're going to put. You're going to put Spanish. All right. Dr. Leafy, have you done inpatient? I'm just giving you your answers. I should probably ask you. Well, let me just do this because you guys can just copy this really. When was the last time you did inpatient medicine?
Last time, actually, I only did observership in the USA,
Okay.
and assistant is a very good, very precious opportunity for me. So for yes, I did outpatient observership in radiation oncology.
Okay. All right. So outpatient's heavy. Okay. Okay. Are there any skills that you think you're weak in?
Yeah, I would say for multitasking, because while I was working as a postdoc, I was also preparing for the USMLE examination and also doing some community service and also being a postdoc mentor for another postdoc. So at that time, because I was too busy, I get stuck on some project which I was working on. So I just let those projects stopped for some time. So I think I was not very good at multitasking.
Yeah, let's not say that.
Okay. Oh, and also another weakness is I feel very nervous when speaking in a lot of persons. I feel a little bit stage fright.
Okay. Okay. These are reasonable. Okay. These are reasonable. So for weaknesses, you want to pick. Weaknesses are not like you're a bad person. These are things like, we all have our strengths in areas and we're light in other areas. And that's okay. That's everybody. You're heavy in some areas, you're light in some other areas. So if you don't know Spanish, absolutely call that a weakness. Okay. It's pretty easy. Okay. You'd be like, I wish I learned Spanish. I don't. If you are an AP, somebody has a comment. Hold on. Oh yeah, you'll definitely stand out. I agree. Like, dude, you need to mention that, Dr. Bina. Okay. So where were we? Oh yeah. So if you're an AP, what you could legitimately say is that, I'm an AP and I have this independent clinical experience as a licensed practitioner, but it's outpatient. It's not as heavy as inpatient that I would like. And so that potentially is a weakness. But you can say how, you can say how, how you plan to compensate for it. Public speaking is a reasonable one. You could say, but you can phrase it in a way that, when you say your weaknesses, you can say how you plan to compensate for it, and also it may also in a way highlight your good areas. So if you say that public speaking is a weakness, but I'm very good one-on-one, I'm very good with establishing rapport with patients one-on-one, but I recognize that public speaking is something that, you know, I need to further develop in. So that's reasonable. Okay. One more thing, sorry, Dr. Ola. One more thing I'll say is that you don't want to be like, yeah, I wake up late every morning. I'm late to work. I'm, you know, I don't finish my notes on time. Like, don't say that. Multitasking is interesting. I would just be careful because you don't know how people would interpret it. You know, because some people will be like, well, my goodness, you're going to need to multitask. Well, that's not good. So I would just be careful with that, you know. So that's what I would say. So Dr. Ola, you had a question?
Yeah, for someone like me who knows like beginner to intermediate level of Spanish, can I say that my weakness is like I can't know up to the level of medical Spanish or something, or like fluent in Spanish?
I mean, can you carry a conversation in Spanish?
The native speaker can understand what I'm trying to pass across or communicate with mistakes.
Yeah, that's fine. Yeah, that's fine. You can say what you're, you know, where you're deficient. That's fine. Dr. E.T.?
Yes. How do we give the solution for the AP outpatient heavy weakness?
Right. So let's talk about that. Let's see. So we need to practice delivering this. So yeah, I think there might be so everybody is a little bit different. You know, I think one strategy for this is you could just simply acknowledge, you know, the fact that it's a weakness. Now, there are other things too. You know, I think you can say how you adapted quickly as an AP, and you can see yourself adapting quickly to inpatient medicine as well. You know, because this was a learning curve, right? Right. So, you know, I think when it comes to being an AP and when it comes to hospital medicine, what they worry about is if you're independent. So let's practice this. So who wants to ask me? Who was this?
Me.
Dr. Leafy? Okay, Dr. Leafy, why don't you ask me about my weaknesses? I'll pretend to be you.
Hi, Dr. Leafy. Nice to meet you.
Hi.
So why not you tell me more about your weakness?
Absolutely. No, thank you for the question. So I would say one weakness that I have is that I am not as proficient as I would like to be in the Spanish language. I may understand some words, but I unfortunately am not conversational at this time. I certainly look forward to growing in this area as I develop a panel of Spanish-speaking patients. I anticipate picking a lot of terms up, and I look forward to enrolling in some home study courses or materials so as to further improve on this skill. I would say another weakness that I have is that in my current role as an assistant physician, where I'm licensed to practice independently, seeing patients in clinic, ordering medications, ordering lab work, developing a plan of care, this experience has been outpatient heavy and has not really provided a lot of inpatient experience. Having said that, what I will say is that as an assistant physician, I've developed a strong sense of independence. I am able to function in a clinical environment without direct clinical oversight, where I need to check every decision that I make. This independence, I believe, will lend itself well in the hospital. I feel like I've developed a sense of confidence as well as independence being a licensed practitioner. I feel that that would translate well into the inpatient setting as I become adapted again to the inpatient environment. I would say my other weakness that I would acknowledge is that of public speaking. While I'm very good one-on-one in establishing rapport with patients, I acknowledge that I can develop my skills more in terms of presentations and public speaking. And so these are areas that I look forward to growing in, and I understand that your program would allow opportunities for me to grow as a clinician in these areas. And so my willingness to learn, I believe, would make me a great fit for your program.
Thank you so much, Dr. Letha. Your answer is great.
So I think like all I remember is Spanish, AP outpatients, and public speaking. And then I can just talk. I can just talk about it. But then I come to an end and then I can cap it off. So that's what I would say. I think for an AP, you have practice being independent and confident. And when it comes to inpatient care, that's what attendings care about. Like, you're not going to be so scared. Like, the worst thing a resident does that an intern does when they're doing an inpatient rotation, the worst thing that they can do is they say, I can't do it. I'm sorry. I need someone to come. That's the worst thing you can do. Now, I mean, there might be some situations where that's warranted, but it's like, dude, this stuff you should already be relatively comfortable with. You want your chief resident or your senior resident or your, by the way, you're never totally alone, just so you know. and just, yeah, there's always supervision, but you don't want to be like, I can't do it. I'm sorry. I need someone to come. That's horrible. So the thing is, even if you're not, if you don't know, the fact that you can function independently and find out, and maybe, you can call. And to be honest, I think that's something you could always say in this answer too, that I have confidence, I've developed confidence functioning independently, and I know when to ask for help. To say that I know, I know when to ask for help, that shows maturity. So for Dr. Ife's question, that's what I would say. I would say I acknowledge that my experience in the inpatient setting is light. However, my experience as a licensed assistant physician functioning independently in clinic has given me confidence to practice independently. I think that will translate well into the inpatient setting, and it helps to equip me to know when to ask for help. You're good. Okay. So somebody have a comment going over this question? I was never sure. Yeah, like, you don't want to say like, I have a bad knowledge base. It's like, no, don't say that. Like, and you don't want to say professionalism issues. Like, yeah, sometimes I just don't work well in a team. like, don't say stuff like that. You want to sort of objective, this is a skill that I'm light on. Okay, there are some skills I'm heavy on. I'm light. So that's what you're trying to do. So, or like, I don't do well with people. Like, don't say that. Yes, Dr. Leafy.
So I was not sure about the Spanish. Can I change it to other language, or is it just?
Yeah. Well, so I mean, it depends. I mean, I think on the program. I mean, I think for a lot of programs, this is definitely an asset. Like if somebody says they speak, like, where's Dr. Javier? Is Dr. Javier there? Oh yeah. When Dr. Javier said, yeah, I would like to volunteer for the Medina Clinic, I'm like, dude, I will personally drive you from Kentucky. I will personally go out there and drive. You can speak Spanish. Like, I will do whatever it takes for you to come and volunteer. So it's a very much an asset. Now, joking aside, so Dr. Leafy, your question. Another language. Well, it depends if it's considered an asset. Like, what other language would you? I mean, like, what other language would you have in mind that you would say?
Like, for example, like French, French is also speaking in some areas of the.
What large French speaking pockets do you have in the United States, Dr. Leafy?
I'm not sure.
I don't think so. No. If you happen to know, that a program has, for example, a very large Vietnamese population, or Somali population, or Sudanese population, or an Arab population, okay, or like Eastern, like a Russian population, okay, then if you happen to know they have a significant population like that, then maybe you could say, you know, 1 week, I understand you have a large Vietnamese or population. A weakness that I have is I do not speak Vietnamese. I suppose that's something you could say, but I think that's a way to slip in that you are familiar with their program. But you know, I think if you don't know Spanish, I would totally use that. Dr. Atoro?
Oh, sorry. We were just we were discussing it.
What's that?
I want to read the patient population in that area and see what's the most common second language, and then you can use that instead of Spanish or something like that. Just don't want to say Spanish because they may not have a large Spanish-speaking patient population.
It's possible, yeah. I think I agree. That's an important caveat. If you know that they do not have a large Spanish-speaking population, then maybe be careful with it. Most communities in the United States, though, most of the time this will be helpful. But yeah, you want to double check. Like, for example, Mid-Missouri, come to think of it. Like, there's a residency program in Mid-Missouri. Yeah, it's not a large Spanish-speaking population there. So yeah, I think if you're in a larger metropolitan area, this is a safe bet, but maybe if you're in a very rural place, maybe not. So point well taken. So thank you, Dr. Toro. Yeah. Okay. Does anybody else? Actually, you know what? You can, like, the number 1 and number 2, you could probably just use. But there might be some other ones too. Does anybody want to do another weakness or do another question? Yes, Dr. Singh.
Yeah, so personally, one of my weaknesses is being perfectionist. Sometimes I think I'm too perfectionist in, like, you know, histories and physicals, and I mean, although I've improved over time, but I think it's still one of my weaknesses, you know, just to be more, you know, focused, straightforward, and not too, you know, overbearing in getting the history or presenting it.
So is it that your style is painstaking and slow, or is it that your style is maybe glosses over details? Sorry, none of that sounded good.
Maybe like painstakingly slow, and in that process, sometimes you do end up glossing over the more important details. Sometimes I think.
The forest from the trees. Yeah. What do you guys think?
I don't know. I think I've heard someone say that they take too long with patients in the room, as that might come across as you care. It might also come across as you don't want to trying to say you rush patients. So I don't know, that might act as a strength more than a weakness if you can spin it. Like, you do, you know, you are detail oriented, you take good notes, and you do give the attention needed to your patients. And I don't know if I would use that as a weakness.
Let me ask you, Dr. Singh, let me ask you this. Do So let me say this. So I'm the same way, just so you know. I'm the same way, perfectionist. I want it to be perfect. And it took me a while to learn, like the whole thing about notes. It took me a while to learn that, you know, just make sure your note is done, even if it's not perfect, just get it done on time. So it took me a while to learn that. So I'm the same way. Now, I found that something that's related to that is that I'm not very good at delegating. Okay. It's not the same thing, certainly, but I find that they sometimes go together. Like, I'm not a good delegator. I'm not a good delegator of tasks necessarily, or it's something I needed to learn. Do you feel the same way? Do you feel like maybe you struggle delegating tasks, or do you feel like I need to do everything?
Yeah, I would say in the past more so. I mean, with experience, I think I kind of learned how to deal with that. But it was definitely yeah, I would say with delegating tasks, spending more time on one task and then less time on the tasks because you know your time is limited. So
Use that. I would use that. I would be careful with the perfectionist thing because it comes up often enough and it drives people crazy. So it actually might be a trigger for some people, to be honest.
Okay.
Yeah. Because what you can envision is someone who's a perfectionist who will be in clinic. If clinic is done at 5, they'll be in clinic until 6:30 or 7. And that will be disruptive. Not that you would do that, not that you would do that, but that's the experience people have with true, like, majorly perfectionist tendencies in residents.
Yeah.
And, you know, and it can be triggering.
Right.
So I would hold off on that. And I'm the same way. I am totally the same way, just so you know. And it's something, you know, like you said, it's learned, you know, you learn how to do it. And
Yeah.
actually what happens is then you're very good at other things, actually. Like you're exceptional at other things, actually. And actually my wife was actually telling me that a weakness is actually a strength that's overdone. So weaknesses are very much related to what your strengths are, by the way. So in one setting, it's a weakness, and in another setting, it's a strength. So anyway, I think that for me, my suggestion would be use delegating. Be like, you know what? In medical school, I'm taught to take responsibility, and because I have so focused on that, delegating is not really a skill that I really received training on. And it's something that doesn't come naturally to me because I want to make sure that things are done right. I want to make sure that I take responsibility for things. And so delegating has not come naturally. And that's a skill that I anticipate growing in during my residency training. That's what I would say.
I think it's definitely a skill that comes with practice. And I think that's in my experience.
Right. And especially if you're working in a team. So you could say that I anticipate working in a team that there might be times where I would need to practice delegating things.
Right.
Essentially. So, okay, good. So that's how I would do that. Any other suggestions for Dr. Singh? You still have your hand up, Dr. Singh. Do you need to have your hand up? No? Okay. Okay, good. All right, guys. Do you guys want to do one more question or do you want to move on? It's actually 10 o'clock, I see. Let's move on. So what I would say is that, okay, after this, I would strongly encourage that you reach out to me to set up a one-on-one, just an hour and a half session to develop your talking points, okay? And then it'll be up to you to practice those talking points, okay? So please do that. Now, if somebody is not a current AP, then here's what you need to do. You either need to sign up for the Bridge to Residency program, or if you don't want to be an AP, but you want to do like one-on-one, then sign up for the interview prep on the website. But it's just a system that we have, you know, like to do the one-on-one and things like that. That's like, that's if you're an AP or, you know, or you took a rotation course or something like that. But if you're not an AP and you haven't taken a course with us recently, then you need to sign up for, either sign up as an AP if you want to be an AP, or sign up for the interview prep if you just want to do the interview prep one-on-one and don't want to be an AP. So that's just the system that we have in place, basically, just to be fair to everybody. And also to acknowledge, like if somebody's currently an AP, to acknowledge that, you know, like an AP actively volunteering with us is what I mean. Because, you know, you spend so much time to travel and volunteer, then absolutely the least we can do is to spend time with you. But if you're not actively volunteering, then you just need to sign up for one of those things, basically. So, okay, guys, well, let's move on because it is 10 o'clock. So always have a question, all right? So when they ask you, do you have any questions for me? You're going to answer what?
Yes.
Yes, you're going to, yes, I absolutely have questions, okay? So tailor your questions to who the person is. So these are just a few suggestions. So the program director, you could ask the program director, so tell me, how has the program changed in recent years? Has there been any change in faculty or any change in the curriculum? What are the future changes coming to the residency program? Has the accreditation been solid for the residency program? That's program director stuff. Faculty, what do you want to see in a resident? What are some skills that you think are important to develop in your first year? What reading material do you recommend for residents? You know, what are, what can I do to make the attending's job easier, or something like that. So that's faculty type questions. Then residency questions. Tell me, have there been any changes in the call schedule? What is call like? Do you feel like you have adequate supervision? How do you like the residency program? Do you like your faculty? Do you have enough off time? You know, is the schedule flexible? Stuff like that, okay? So tailor your questions to the person. Something that I try to do is I try to look up their research, like what they researched on. I did that with faculty, actually. I thought it was okay. It was okay, it wasn't bad. But like I would see like, what did they research on? And then I would ask, I would say, you know, I understand that one of your research interests is in, dermatology. And so I'm wondering, can you comment more about the dermatology experience that I can have in this program? So what you've done is you've boosted their ego because you have recognized their research interest. So you can look stuff up about them ahead of time if you want. And then you can see if you can, you can mention it and make it relevant to a question. So that's what I suggest doing when asking questions. So any suggestions on this part? Any questions or thoughts on this? Anybody? You can kind of relax when it comes to this part. You're like, okay, I'm going to ask questions now, so you can relax a little bit. But anybody disagree? Anybody have any other suggestions? No? Okay, all right.
I do. Maybe you could show interest in the community itself rather than just the faculty, because they want people that will come and stay.
Yes, yes, fantastic. Give me an example, Dr. Tor. Like, what would you ask?
For example, if people that live in the big city and they want to stand more chance in doing like a rural tract in family medicine, you'll be going to a rural community. So what it's available in the community to do, what's the culture like over there, what people do for fun. Maybe this is where the hobby thing will come in.
Yeah, when you talk to other residents, for sure, that's where the hobby thing comes in. Yeah.
Or like community service, if the program is involved in community service, because some of them were like, yeah, we're a community-based program and we do this and do this.
Right.
And do that.
Right. Good. Good. Wonderful. Absolutely. So to express interest in the community. Yes, Dr. Leafy.
So I was wondering, for example, when I ask the professors research, but if some professors were not using a certain type of technology, but if I ask those questions, I'm not sure if they are still actively researching on those. Will that be appropriate to ask something they're actually not researching on it? Will they be unhappy on it if I ask those research that are not doing anymore?
Well, I think the idea is that you want to make sure the question is geared towards the residency. So we're not asking them about their research. You can sort of mention, I understand that this was a research interest, and is this something I might have an opportunity to research on during the residency? Or, in this field, is this something I can get a lot of exposure on? Or it could be a general question. I understand that one of your interests is research. Could you talk to me a little bit more about my opportunities for scholarly activity at this program? It could even be general like that. So the question is about the residency itself. You can casually mention or maybe clinical interest. I said research interest, but probably what's more appropriate is you can say, I understand you have this clinical interest. That's probably better. I should have started off with that. So, you have this clinical interest. Can you tell me about exposure to this clinical area during your in this program? So.
Thank you.
Yes, Dr. Ishraf.
I was just wondering, most of the information is already online, but if we ask some questions to the program director, like something that is already written online, and does it sound like you haven't read about our program or something?
No, if you ask about future directions of the program, that's not online. Recent changes, that's not online. Accreditation, that is definitely that's not that yeah, they'll say they're accredited, but were there any issues with accreditation? Or that's definitely not online. So, I think future direction, recent changes, none of that stuff will be online actually. Or not to the extent that they can talk about. Like they could probably talk about it a little bit more,
Sure. Thank you.
Or you can even ask the program director, where do residents usually go after graduation? That's another program director, because they'll be aware of that. Do most of them practice locally? Do most of them go out of the state? So things about the program, any things about now that may be online, but it may not be. And even let's say, even if it were online, so what? I mean, it's not like they're expecting you to have read everything necessarily. Or you could even say, I noticed online that there are a lot of residents that practice locally. Can you tell me a little bit more about that? What kind of practices do they do? Do they join a large group? Do they do private practice? Can you tell me a little bit more about what your residents do after graduation? So you can even slip in something you saw online and ask them to further expand on it. So, yep, Dr. Jaya.
Yeah, so I always had this question actually for residents, but I'm not sure if it's okay to ask them. Is that, do you have kids? Do residents have kids? And how is it for them? Like, how is family life? Is it doable? And sometimes I wonder, maybe asking them might be maybe something not negative, but like it might influence chances to get a spot.
Yeah, so I think some of that is specialty specific. So family medicine should not be a problem. Like, it really shouldn't be. So if you're going to ask, especially if you ask other I think that's a good resident question. So if you ask other residents, as far as time with family and things like that, that should be fine. I think if I were to ask my sister, for example, she did a general surgery residency, Yeah, from what she was describing, man, this will go on YouTube. See, I turned off the comments, so no one can leave comments. But I don't know, man. I think like if you're in a high-powered residency where they're expecting you to, not high-powered, that's not the right word. You have plenty of family medicine residencies that are very high-powered. If you have a program where the culture is like, yeah, you're sick, we still want you to come to work, we don't care if you have COVID, you know, then that might be something to be careful about. So I think family medicine is fine, and especially if you ask the residents, I think it's very normal. It's very normal to ask that question. Dr. Ishra?
I forgot to take my hand raised.
Sure. Dr. Ola?
Is this an appropriate question to ask the PD? Maybe, is there any part of my application that is of concern to you that you would like me to address?
Yeah, what do you guys think? What do you guys think about that?
I think that's a great question, actually.
Can you repeat the question? I didn't catch it.
One more time, Dr. Ola.
Okay. I would like to know if there's any part of my application that's of concern to you that you would want me to address.
I don't think that we should
That's
ask.
the question to the PD.
I wouldn't risk it.
Yeah.
I feel like it's just highlighting flaws. I mean, if they ask you
Flaws.
about your weakness and you said what you had to say, move on. They saw your application, they like what they saw, and they give you an interview. I wouldn't really want them to, you know, I mean, because most of them will print out your personal statement, and I've had one that highlighted a lot of my personal statement questions they wanted to ask me. So my opinion, I would leave it alone. I wouldn't ask them if there's anything on my application that I should address. That's just me.
I thought he said CV, not application.
Good work.
What's that? Sorry, I didn't catch it.
Dr. Sani, can you repeat your comment?
I think Dr. Singh said the question is, if you ask the question, is there anything on my CV, not necessarily in my application? So making the distinction, is that right, Dr. Singh?
Yes, sir. That's what I meant.
Yeah.
I think your CV is your whole ERAS application. Yeah.
You know what my thought when you were saying that, Dr. Ola, is that there are some times where if somebody had like a personal tragedy or personal difficult circumstance that may explain something. So for example, there's another AP, she's not volunteering now, but she used to. She is very smart, very, very smart, but she failed her first attempt at step 1. And the reason she failed it is because she took the test in Nepal at the time of an earthquake. And what happened was the power went out 8 times, she said. The power went out 8 times during the exam. And it's by computer. And the power went out 8 times. And she failed by 1 question. So to me, it's like, those are very relevant things to bring up. So if a program director were to say, well, you know, Dr. So-and-so, I think the thing that's very good, but, you know, the fact that you failed the exam, she could say, well, actually, I just want you to know that, you know, I absolutely, normally I'm a very good test taker, but I took that exam during an earthquake and I failed by 1 question. But when I took it the second time, I passed. So I feel like if there's some story that can explain, then that might be a good opportunity to you know, you could ask, you know, might be a good opportunity to ask that question.
Okay.
Yeah, it's interesting. Go ahead, Dr. Singh.
Yeah, so in my personal experience, I actually did my medical graduation from India. I grew up in the United States, but I went to India. I came back and I immediately took the CS exam after my step 1, and I didn't have any US clinical experience at that time. So I was just bringing my clinical experience from India and mannerisms and all that. And then I ended up failing my CS exam actually. And I failed it a second time. And second time was just sheer nervousness, I think. I think I had some stage fright because of that lack of US clinical experience, gave me a lot of stage fright and nervousness. And the standardized patient could see that. And it was, and because of that nervousness, I was missing questions and all that. So it's kind of like a good, perfect storm almost type of situation. And I had an interview with a program director once, and he said, I can understand one attempt in the CS, but I can't understand two. And I was kind of caught off guard by his remark. And I was wondering, how would you or how would anybody answer that or handle that kind of question?
Very interesting. What would you guys have to say? How would you handle that?
You can say I took some time, I learned my lesson, something like that.
What made the difference? What made the difference when you passed it? When you passed it, like what was it? What did you overcome?
Honestly, I think it was just, being too nervous, literally having stage fright. When I would see the patient like normally in clinic, it's okay, not as, frightening or nervousness. But, when I went into a standardized test, I had that, I think, hovering over me quite a bit. And that increased my nervousness, gave me a lot of stage fright. And that was very readily visible to the standardized patient. And then I think the third time when I took it, I was just like, just relax, it's a normal clinic. It's a normal patient. Just ask your questions, do your physical, do your counseling, and do your note. And I think I kind of talked to myself like that during my third time, and then I ended up passing.
The way to address it, maybe just that. Maybe just that, Yeah, I think so just explaining it just like you explained it now, maybe the way to do it. And to just say that, that stage fright was something that was really, that really affected me. And it wasn't until I saw it like a normal clinic. You can even make it a way that to say that it's because I'm so comfortable in clinic. It wasn't until I saw it as a normal clinic, normal patient, I do my normal routine. When I finally saw it as that, that's when I got comfortable and I relaxed and I was able to pass it. But before, maybe because I was relatively new to the United States, I had stage fright, and I just didn't quite, it was just so different than a normal clinic. I just had trouble seeing it that way. But when I finally saw it that way, then I was able to succeed like I normally do in clinic, something like that. So anyway, the key there is you just describe, like the way you just described it, Yes, Dr.
Yes, I just wanted to add to what he was saying that I know that the first time you mentioned those reasons why, then the second time it could be like, okay, I was rushing, I wanted to still make it and everything. And then the second time when I failed, I took a step back and I realized I needed to sit down and analyze the reasons why I was failing. And then I pushed through and it showed my resilience. I decided to take it the third time. Just don't only mention the negative part, like, oh, you failed. Also mention the lessons you learned from it and how it made you a better person. Sure. Something like that. So that the interviewer also doesn't emphasize on what you are emphasizing on.
Right.
I think the first time was definitely stage fright, and the second time I was overcompensating, and I would spend so much time in the room. The proctors had to get me out of the room, I think 4 or 5 times, because I was asking too many questions, being too in depth, and losing time, and that's why I failed the second time.
Yeah,
I was overcompensating.
Yeah, I think when you talked about how, that's fine. I think I'm joking a little bit. I think you know, I think the general gist of, you know, I just relaxed. I relaxed and I saw it like a regular clinic, and that's when I was able to succeed. And because that's where I thrive. I thrive in clinic. You know, I think that's compelling. That's compelling. And if it does come up for you, Dr. Singh, that might be the answer that you give. I was just able to relax. I saw it as a normal clinic. And it took me a couple of times to realize that. But when I realized it, I passed just fine because it's just.
Yeah. Seeing that not as a test, but as an actual patient, I think helped me.
Right. Exactly. When I saw it as an actual patient, then I was able to succeed. That's what I was.
Right.
Yeah. So yeah, you get these questions that just throw you off sometimes. Yeah, I think sometimes just sort of walking through what happened, you naturally will give the answer like you just did. So yes, Dr. Itoro.
So I had that question in an early first time I applied for a cycle.
I just want to say, make sure during all these questions, you're smiling, you're looking at them in the eye, and you're sitting up straight, okay? Okay, go ahead, Dr. Itoro.
So yeah, I had that question why I had this attempt on my USMLE, because I had to take this ES as well twice before I passed it on the third attempt. So I answered like you said, I have test taking anxieties and I was just very nervous. And but I kept working on it and I improved. So after that interview, I told a family member who is a physician my answer to that question, and she's like, I should never have said that about test taking anxiety, because then they're going to pin me as someone that would never be able to, like, will struggle really hard to pass further exams, because they want people that will be able to pass exam and graduate, you know, so that their numbers won't go down. So I don't know how you feel about that, because when they ask me about my attempts, I try to stay away from saying I have test taking anxiety, even though that may be true. I think what I've been taught to say is to always try to say I was not very prepared. I thought I was ready, but I wasn't ready. And then after that first fail, I did this, did that, and make sure that I was ready. And then I went back and took it and I passed.
Yeah, my thought is, like, sometimes we underestimate what life is, what's going on in life at the time of those exams. You know, I would try and think what was going on in life. So, was there any turmoil? Was there any crisis? You know, if there was a crisis, mention it, because that would affect anybody. So, or if there's any difficulty that you were going through, or you had to work multiple jobs, or, you know, you had a family crisis or family obligations, those would be the things that would be most compelling, I think.
What if you didn't have crisis? You're just a person that is nervous when you're about to take an exam. It's like, because I'm that way. I can know I have the knowledge, but when it's time to test, I just like, because once the anxiety hits you, it's like you don't know anything. And I don't know. That's always the hardest question for me to answer on an interview, explaining my attempts. And I'm crossing my fingers that I don't get asked that question.
No, don't cross your fingers. You better make that as a question to prep for. So let's when we do individual interview prep, let's talk about that, Dr. Itoro.
All right.
Yeah, and I think so we can do that. So when we do one-on-one, we can talk about the talking points for that. So that's just a plug. Make sure you guys schedule a time to do the one-on-one, and please do so through Canvas. I would just ask, please do it through Canvas. So, okay. All right, guys. So let's move on. So everything is an interview. All right. So lunch, pre-interview dinners, any casual conversations you're having with administrative staff, it's all an interview. So be very nice, be courteous, smile, look them in the eye, okay? So make sure just because if you go to dinner with them the night before and they say, oh, just relax, just, just be yourself. And personally, don't do that. Just you're in an interview, okay? I feel like I've seen too many times where there were things in the pre-interview dinner that the residents were like, oh no, I don't want to work with that person. I just feel like I've seen that one too many times. So just remember, everything is an interview. Any questions there? No? Okay. So then the last thing is just make sure you're well rested. Yeah, make sure you're well rested and you're able to communicate and you're sharp. You're as sharp as you can be. I can tell you there have been multiple interviews I messed up because I was post-call or I didn't sleep well the night before, or I was on call a lot that week. I am horrible when I'm tired, I gotta tell you. So, everybody is different, but just make sure that you're well rested so that you can be pleasant. I think when I'm not well rested, I'm grumpy, actually. It's not good. So just make sure you're ready. Okay. Take care of yourself. Make sure you're feeling good, you're sharp, that kind of thing. The other thing is off the wall questions. We're getting kind of late. I don't want to spend too much time necessarily, but let me ask, has anybody gotten questions like this? Like really just bizarre questions, like if you could be any animal, if you could be a fruit, what would you be? I mean, just something very bizarre. Does that happen nowadays? You guys get that?
One of my friends was asked to say a joke.
What? Who said that?
Tell me a joke.
Who said? Who's?
A program director asked my friend.
Dr. Ashraf, they asked you, tell me a joke.
No, not me. They asked my friend.
Your friend? Oh.
In residency interview.
So tell me a joke. What specialty was this?
Pediatrics.
Oh, see, that makes sense.
Mm-hmm.
That makes sense. Yeah. What did your friend say?
She was not able to tell a joke, and she did not match there. She matched in a different place, but she was not able to do it very well because she was not prepared for a joke.
Yeah. That's a tough one. That is a tough one. I don't have an answer for that.
Maybe practice one knock joke.
I was about to say, not one, why did the chicken cross the road?
One of them.
Or even a medical joke. Yeah, that's difficult. That's kind of unfair, to be honest. Yeah. I think peds, and that might be something that particular interviewer, is maybe a tactic that they have that they think works well, or, maybe that's part of peds training. I don't know. But yeah, that's interesting. My thought for this one was that if they ask you an off-the-wall question, tie it into why you would be a good fit for that specialty. Somehow tie it into why you'd be. The joke thing is new. I've never heard that. But if somebody says, whenever you look at a sign on the road, what do you think of? To say that, when I look at a sign, I think of good communication and why that's so important for good patient care. Something like that. So just tie it into why you would be good for that specialty. Why you'd be a good fit for the specialty. Now, if you could be any animal, what would you be? I would be a bird, so I can have a bird's eye view to see the big picture. And in family medicine, that's what I need to do, is see the big picture. Something like that. So off the wall questions, just do your best and try to tie it into the specialty, is what I would say. So, okay. Yes, Dr. Ify.
Yes, I got a question last year about if you were to write a book title about your life, what would the title of the book be?
Oh, very interesting. What did you say?
I don't even know. It caught me off guard. I
Yeah,
just
yeah.
came up with something.
I have an answer for that question.
Yes.
Okay.
What is it?
Just one word, matched.
What did you say?
Matched.
Matched.
Match. Okay.
That's good.
That's
So let
the-
me say, so a
That's the
book.
end all be all story for a lot of people here.
Oh no, it's just the beginning. Let me tell you, it's just the beginning. It is
Well,
just
it's the beginning until we get there.
Oh my God. Yeah, no, it's just the beginning. Actually, you know what? If you think, tie it to the specialty, just say family medicine. You know what I mean? Just tie it to the specialty somehow. Like, what title is the specialty, you know? So I don't know. That's if you're in, like, if it catches you off guard, like if you're having a hard time and it catches you off guard, try and tie it to the specialty. So yeah. Matched
Thank you.
in family medicine. So okay, guys, interviews via Zoom. I think we did that. And then a recent trend that I'm hearing about is group interviews. Sometimes you will have like a panel interview you. So that's something you may experience as well. And my suggestion is that nonverbal communication and body language is even more important here, because you know it will it's something where more people will catch it. And group interviews are actually, it's a more evidence-based way to interview people because multiple people are assessing you. So if you have good nonverbal communication, multiple people will catch that, or it's more likely multiple people will catch it. So, so anyway, that's something that you may see. So any comments or anything about these that you guys have noticed? I guess the last thing is the thank you cards and emails. Generally, the convention is do this right away. Send thank you cards and emails and just do it right after the interview, basically. So, okay. Any comments on these, or do you disagree with anything here?
I have a question.
Yes.
So for the thank you cards or email, do you mean one or the other or both?
What do you guys say?
I don't know if this will apply, but there's some programs that say don't email them. I don't know if that is just for emailing to express interest or emailing for thank you. But if they say no emails during the main match, I would rather do a thank you card. So maybe like one or the other.
So yeah, definitely follow the instructions for sure. For sure. Yeah. If you're allowed both of them, Dr. Ettore, what would you say? Do both?
If I'm allowed both, I would do an email right away and then send a thank you later just to refresh them of who I am.
Okay, so it's a little strategy there.
Yeah.
Send something immediately and then a little delayed so they remember. Okay.
Yeah.
Okay.
Any other thoughts on the thank you cards and emails?
Yeah, or send a thank you email within 24 hours after the interview. And sometimes in February, when they're doing the rank listing, then you send it thank you cards.
Yeah.
Yeah.
And correct me if I'm wrong, anyone. I don't think it's against the rule to express that this program is your number one, right? You can always say, I really enjoyed the interview, talking, meeting, doing this, and I like this program is my number one ranked program, something like that, or just avoid using that word. I'll be ranking you guys number one, because I've heard like stories, say it, don't say it, because you really want to express interest in the program.
What do you guys have to say about that? Saying that you're my number one choice.
Does that mean you're only going to send to one program that day, or you're going to send to all the programs you interviewed as your number one that day, your number one?
I mean, if they're truly your, am I okay? Yeah, if they're truly your number one, is it okay to express that? I'm not saying you should. I mean, even if you say all the programs that you interview with that they're your number one, they're not going to interact with each other. So they, maybe I shouldn't say this. You'll be on YouTube, right?
I think that most people recognize that a lot of people are bluffing nowadays.
True.
I think a lot of people realize that. Even when programs say they're going to rank you highly, it doesn't mean you'll match there. Like if they truly did rank you highly, you should match there, but that doesn't happen. So I think a lot of it is bluffing. And so
stay away from it then.
I don't know. I don't know if it adds much. I don't know if it adds very much. I think the goal, now granted, I'm further removed from this than you guys, but I think the goal is to make sure that, you know, they remember you, that it's very positive. It's almost like when you say, I'm going to rank you number one, how positive is that? I don't know. Like, it's almost like I don't know. It's one of those things that you don't know how it'll be interpreted.
Yeah.
So if it were me, I would just kind of be safe. I really enjoyed the program. I hope to have the opportunity to work with you. You know, I hope to have the opportunity to work at your residency program. That's kind of saying the same thing.
Yeah.
You know, but it's not like a loaded comment.
Right.
You know, so that's what I would do. I wouldn't say, you know, so anyway, that'd be my take on it. And then also too, my thought is like, what if you change your mind? What if like the day you submit your rank list, we're like, you know what? No, I want this other program, you know? Like I just, or what if you interview somewhere later and you're like, oh no, I like this one way better. You don't want to lock yourself into, oh, this place is number one. I don't know about that. So you can say something very positive. I hope to work with you. You know, I was very impressed. I really enjoyed it. So I think that's respectable. So, and again, I don't think it adds much. Actually, I literally saw one time I saw someone indicate that they were going to rank our program number one, and for some reason that freaked the residents out because they knew that if they ranked this person very highly, that person is coming, and they weren't so sure if they liked this person. And because the person said, I am ranking you number one, it spooked them. It was really bizarre. So I saw that one experience. I don't know. People, you never know. You don't know how people will react. So. All right. Well, good. Okay, guys, we set the record for the longest ever interview prep tutorial. So next year we need to start this at 7. I'm sorry, you guys. You guys probably have families and stuff. But so let's pause and let's ask any last questions at all. Any last questions, final questions?
Yes, Dr. Meredith, I have a question. So some states have a license to work as a physician, although it's called a different name. It's not called assistant physician. They call theirs limited physician license or something. Okay. So is that right? Is that the same thing as the assistant physician license? Because not everyone is, I don't know.
I'm not familiar with the other states necessarily. What do you guys know much about that?
Like in New York or Arizona.
Yeah, I heard about those states. I mean, it sounds like it's similar. It sounds like it's a similar thing. Sometimes they call it associate physician, I think, but I don't know what those states call it exactly. So
I would just state what the licensure is and in what state, and just try to give it a little explanation to what it is. So don't use assistant physician for another state licensure, because that's not what it's called. Missouri is calling it assistant physician. Arizona is calling theirs transitional training permit. So just call it what it is. And then just then explain a little bit of what you do with that. Yeah.
I agree. That's more important. You want to explain. I think assistant physician actually works out well, you know, because that's a discipline by itself. And then, like Dr. Toro said, you need to say what you do. You see patients, you write notes, you prescribe meds, you order labs, you refer, you see patients for follow-up, you participate in office procedures. Like, that's all part of it. Those are the things that you do. So talk about what you do for sure, and that you're licensed and you have a collaborative agreement with a family physician. For those of you that are applying to family medicine, you know, as an assistant physician, I have a collaborative agreement with a family physician where I independently see patients, you know? So yeah, it's more important to talk about what you do and call it an assistant physician. I think it's fine.
Okay, thank you. I just have to explain to some people that think it's a PA rather than an
Yeah,
AP.
you could say it's a mid-level provider, just like a physician assistant, but this is for medical school graduates that have not yet started residency.
Thank you.
Yeah. But then quickly say, I collaborate with a family physician. I see patients. I write their notes. I prescribe meds. Make sure you say that stuff. Like, whenever someone says, what's an assistant physician? An assistant physician, it's where medical school graduates are licensed to practice medicine in collaboration with a physician. So I collaborate with a family physician and I see patients, do the notes, prescribe meds, order imaging, et cetera, okay? So that's what I would do. So you really want to talk about what you do. So, all right, you guys, any other questions? All right, I think most people here have interviews. I think this is probably the highest percentage of attendees that have interviews that I have seen actually in recent years. So, good luck to you guys. Make sure you prep, make sure you do your best. And please reach out to me on Canvas to set up an interview prep. And if you're not currently an AP, please sign up for one of the programs online so that, you know, we can do the interview prep. So any final comments from anybody? Okay, you guys will do great, okay? Hang in there. And remember, you've got a shot, so hang in there. All right, we'll talk again. You guys have a good night.
You too. Thank you.
Thank you.
Thank you, Dr. Murad.
Thank you, Dr. Murad.
You guys will do great.
Thank you, Dr. Murad.
Thank you, Dr. Murad.